Rabies is a viral disease caused by the rabies virus, which primarily affects mammals, including humans. It is transmitted through the saliva of infected animals, usually via bites. Rabies is almost universally fatal once clinical symptoms appear, making prevention and early intervention critical. Animal bites are the most common mode of transmission, particularly from dogs, which are the most common global source. Bats, raccoons, foxes and skunks are also notable carriers. The virus can also enter the body through scratches or broken skin, especially if contaminated with saliva. Transmission through organ transplants or inhalation of the virus in bat caves has been documented, but these cases are rare. Symptoms of rabies typically appear 1 to 3 months after exposure, but can vary. The disease progresses through several stages. The prodromal stage lasts 1 to 3 days and includes fever, headache, general malaise, and pain or itching at the site of the bite. In the acute neurologic stage, encephalitis leads to confusion, agitation, hallucinations, and paralysis. Hydrophobia causes severe difficulty swallowing and fear of water, as well as spasms in the throat. Aerophobia results in sensitivity to air or drafts. Without treatment, rabies progresses to coma and ultimately death. Usually due to respiratory failure, diagnosis of rabies is primarily based on clinical symptoms and history of exposure. Laboratory tests are used to confirm the diagnosis, including the direct fluorescent antibody test, which detects the virus in brain tissue, usually post-mortem. Serological tests or blood tests can detect antibodies against the rabies virus, but these are not typically used for diagnosis in symptomatic patients. Once clinical symptoms of rabies appear, the disease is almost always fatal. Therefore, immediate treatment after potential exposure is crucial. Post-exposure prophylaxis, or PEP, involves several steps. First, wound care. Immediately wash the wound with soap and water for at least 15 minutes. Next, rabies immunoglobulin, or RIG, is administered to provide passive immunity. Then, a series of rabies vaccinations, usually 4 doses, are given over a period of 14 days to stimulate active immunity. For symptomatic patients, supportive care may be provided to manage symptoms. Preventing rabies involves several strategies. Vaccination is key. Regular vaccination of pets like dogs, cats, and livestock is crucial. Individuals in high-risk occupations, such as veterinarians and animal handlers, should also be vaccinated. Avoiding contact with wild animals and educating the public to report stray animals is essential. Public awareness campaigns inform people about rabies prevention, symptoms, and the importance of seeking immediate care after potential exposure. Additionally, animal control programs aim to control stray animal populations and monitor wildlife for rabies. Complications of rabies primarily arise from the neurological damage caused by the virus. This can lead to long-term neurological impairments in the rare cases of survival once symptoms appear. Survivors may also experience psychological effects related to their illness. Rabies is a preventable viral disease with a nearly 100% fatality rate once clinical symptoms appear. Understanding the transmission, symptoms, and prevention strategies is essential for reducing the risk of rabies. Immediate medical intervention following potential exposure is critical for survival. Public health education and vaccination programs play a vital role in controlling rabies and protecting both human and animal populations.